Yesterday, like after the data entry, I wanted to continue the data quality, but it was already too late. What we do, we focus on a bit on the concept. Since the material, the presentation is already in the Moodle, you can download it, it's fine. Okay, so we don't go through the whole concept, okay? Does not work? Or? So we all know this one, right? Everyone has seen this slide or understand in the health information system when we work, garbage in, it's always garbage out. So we know that. Yeah. Like for example, in Bangladesh, Azad, Professor Azad, like he was saying, no, this data is too bad. We can't use it. But the problem is, if you don't look at the data, then data quality will never improve. So that's how it's a vicious cycle. The policy makers, they always say, routine HMIS, no, we can't take this one for the policy decision making or anything. Because we trust a survey, it's real data. But if you want to increase the quality of routine HMIs, you have to look at the data and then say, okay, this is this one, this is different. And then you can improve the data quality. We have long list in every countries. We try to, in South Africa when we started, the whole concept was on essential data set. That means collect as essential as possible, as minimum as possible. Then the data quality is very good. For example, if we just collect, let's say 5 data items, delivery, measles, cesarean section, ANC registration, and then say PNC, that's it. 5 and nothing else, the quality will be very good. And then we can monitor very easily. If your data set is too long, then the quality will reduce down. What you can try to do, if data is too long, you can star or make compulsory few data elements which you want to monitor. Okay, so, and then you can closely see how the quality works. There has always been a debate about routine HMIs and the survey data. So anyone had this problem? Because always the policymakers, they want to go to the survey data, not to routine HMIs. But routine HMIs has its own purpose. Survey has its own purpose. Survey is to see how the impact of the health service happened. Routine HMIs is to monitor how our health services are performing. It's a two different aspect of monitoring. If you want to monitor the impact of the health service, good, use survey. For example, maternal deaths, infant deaths, routine HMIs, you can't collect it because they're always underreported and not everything is reported. So you use that one in a survey. But on routine HMIs, you can collect, say, ANC first checkup, second checkup, and all the things. Those ensures the quality of the service. For example, you can say delivery, total delivery. So everyone knows total delivery, right? And then you say how many delivery happened and then discharged within, say, 48 hours. You have these data items in your place? Because usually what happens when delivery happens, it is compulsory that like a pregnant woman stays in a hospital for 2 days. Yeah, 2 or 3 days, depending on whether it is cesarean section, then it is a week or something. Yeah, is that right? I'm telling right? The health people? Yeah? No? Yes? Yes? Because in rural area, what happens? They deliver, and they don't want to stay long, and they just get discharged and go home. Yeah, and sometimes they don't even just discharge, they just run away. Yeah, like in Vietnam, like when my wife got delivered, they locked the door every evening, the main door, so no one can go out. And if you want to, like I was saying, no, I'm just going to get some food. Then they say, really? Now? Because Vietnam, they eat very early, and then I was saying, no, I just came, I'm hungry, and then I have to give all the explanations. But I say, I'm coming back. Yeah, so this total delivery, it's fine. But like the That is like how the service is happening, but the quality is like whether all the pregnant women staying for two days. That's the quality of the service, and this is very good to collect in HMIs, not in survey data. Survey data, you can collect all the infant deaths, the family planning, all the things you can use survey. Most of the country in the family planning, you have number of users, oral pills users, condom users. It's very hard to collect in a routine HMIs. You know, like what routine HMIs does, the health facility does, is distribution. So much oral pill is distributed, so much condom is distributed. But we don't have the capacity to monitor every single pregnant woman saying, are you taking the pills? Really? Let me see. We can't do that one. It's very hard. Even if we collect it, it's very, very hard. But in almost most of the countries which I know, Sri Lanka, Laos, even Myanmar, I'm not quite sure. Myanmar, do you use oral pills user or oral pills distribution? Sometimes they use both. Yeah, so like it's depending, like oral pills users and things is very hard to collect. Something which is hard to monitor in a routine HMIs, we can always flag it and say, it is very, very hard. It's a good data item, but like please move it to your survey. And survey can also be connected by the health department itself. It's okay. Because usually surveys are costly to do all the things. But with a bit of training and like things, you can easily identify different health centers, catchment areas, and you can do the survey. Okay. Tomorrow, I guess tomorrow night, Arthur will come. He's the real health guy. He's a medical doctor and all things, and you can ask about your form to him. Okay. So unfortunately, we don't really have a real health person. We have Sri Lankan doctors, but like you know, Sri Lankan doctors are Sri Lankan doctors. They're very good. Okay. So we have 4 C's. Everyone knows this one: data quality, current, correct, complete, consistent. Okay, it has to be current data. Like in Laos, when I was analyzing the one of the health facility, I showed them one of the district actually. I imported all the data. There was one district, one provincial hospital. They sent the same data for the last year. Yeah, last year January, and this year January, or like or the physical year, it was exactly the same data. A copy and paste. And then like in DHIS, you can easily say, hey, everything is the same. So we were looking at the one data element, and it was exactly the same value. Then I just like have a note. Then like I put the whole whole data set of last year's January and this year's January, or last year's, 2 last years. And then I compared it. Every data item was exactly the same. ANC 30, delivery 20. So last year and this year was exactly the same. So current, you always have to make sure like you report what happened now. Yeah, that's the good thing about DHIS. When you report it, you can easily identify where, which facility I just like copied and pasted. Okay? And it has to be correct in the sense, usually sometimes what happens, the people when they report 2,000 deliveries, and there was, again, sorry, now, taking your example because I was just there last week. We had how much premature birth? 3,000 in one facility in one quarter. And that was like when we were looking at this particular province, was just woo. And then when we see in which quarter, it was in only one quarter, and then that province and district really didn't have that much population either. So just make sure, like when we look at the data, we have to see whether it is current, whether it is correct, whether it is complete. And complete has 2 different meaning. Like for example, a person from Bangladesh was asking, John, we have a module in DHIS where it says how much completeness of a data set is. In a data set, if you have 1,000 data item, it will say, okay, person has filled in 20% of the fields. Rest are blank. That form was ICD code, yeah, underage, like all the age breakup, age and male, female breakup, and then diseases. You can't use completeness for that because completeness, it depends on whether they have filled in all the data. You can use that one for immunization, fine, when you have 5 data items. If you are using a lab test, it's okay. But if you are using for disease, ICD codes and other things, please don't do that. Completeness, it's always about specific service. And you can say, okay, these are the different data, whether people have filled in. And you can ask, please enter 0. Yeah, for a couple of things if you want to look at the completeness. Are you clear about this completeness? Yeah? Don't use the completeness for the big form and especially the ICD codes. Its completeness is basically used for smaller forms like immunization, lab tests, and things. You can have a group and you can say how many people have filled in. Like this completeness, like when we started in India, a health center had 7 forms. They used to fill first 2 pages and last pages. Because the medical officer who used to sign like this, look, okay, good. Okay, good. And then the last pages, sign it and send it up. And then the person who is filling, they are very clever. They always say, I don't want to report so much. Like, let me just like fill this first page and last page and give it to them. And so we can look at the different groups whether they have filled it or not, and it's good. Okay, to check the completeness, but not for the big form. And consistency, it has to like. There are some problems with the consistency. Like you have to report the same month every time. So you report for 2 months, 6 months you don't report at all, and then you report in other things, other month. That's also you need to check. These are the things when you look at the data, the big data. We are all like implementers, health officers, and IT persons at the different level. So when we are looking at the data at our province or the district, make sure that like you see for all these things. Consistency, it's also a problem. I was in the, again, for example from India, in Leh, north of India. And then we were in that one district and say this 4 block is not sending the data for 6 months. I say, why? You know, like it's a snow area, so when snowfall comes up, so 6 months everything is closed. The road networks and everything. I said, okay. At that time, like I was just saying, technology is like we can do everything. And then, no, we can use mobile phone for sending the data. Sir, there is no mobile network, everything is closed. What about landline? Sir, everything closed. There is only 1 satellite phone. That's it. For 6 months, when snowfall, and that like it was 2 block, you can't have any access. And that's when like we just say, I agree, okay. You send us the data for next 6 months because they supply all the medicine 6 months before. If they forget, it's not. Yes, the infrastructure is like that, like we can't really sometimes help. But in most of the places, they have to send the data every month, okay? And it should be consistent. Like for example, Mozambique, it's a long country in Africa, the longest coast. When they used to send the data, they can send it to anyone. And then there is Bissau, there is a Minister of Health. It's next to on the road. So people used to fill up the data, bind it up, and give it to the bus driver. And bus driver like used to drive and like, there we go. Now this was the real case in 2004 or 5 when I was there. Yeah. Next one. Okay, common problem, large gap, unusual month variation, duplication, inconsistent, typing error. Like these are the different common problems what we find in the data quality. Yeah? I'll leave the presentation in the Moodle, so you can please download it and like go through the different concept. And if you have any problem, you can ask. I don't want to always talk, so it's different. Yeah, you can skip this one, you know. When we decide, just a few minutes on this slide, we must know, should know, nice to know is always dangerous. Can someone give an example on this? Health person from Solomon Islands? example on this? Because you deal with the data. Anyone? What do you think should be must know? Like, let's take one program. Let's say immunization. What is must know, should know, and nice to know? Immunization, just say one program, immunization. I'm just taking the very common program. M?
I'll try. We must know is number of BCGs given at birth.
Okay.
Should know coverage rate for the state, for the coverage.
No, don't worry about the rates. You know, like it's just like
The
when
coverage,
we are collecting the raw data.
So the coverage could be should know.
No, don't worry about the coverage. Coverage
okay.
is it's a process indicator. You know, like when we are
okay.
collecting the data, we collect raw data. So you're saying should know is must know is BCG given at birth. Should know is. Let's take the same example.
Yeah. BCG, BCG not given. No, that one.
Live birth.
Yeah, live birth.
You have to have a live birth if you are collecting the BCG at birth, right? So you have to know how many people born and how many people given BCG at birth. Must know if you are looking at just the BCG coverage as your main target. Must know is BCG. Should know is a target population. Yeah, like a live birth. Yeah. Nice to know.
Why
Nice to know, like say whether the parents are educated or not. It's nice to know, right? If the parents are educated, they know about vaccines, so you can get. And that is dangerous. We should not collect that one. Whether the parents are educated, whether the parents have work or things, that's bad. That you can do it in the survey, okay? So always nice to know, don't collect in the routine HMIs. Must know, should know, fine. Okay? So and then it's both are linked together. Okay. Next. Yeah, I'll leave this one. It can be there. It's also. Just one in the back. When we are looking at the big data, and like a statistical person from Nepal sitting next to Myanmar, they can tell you, because statistical persons, they have a clear eye of looking at what are the outliers and where are the things. Yeah? So we always look at obvious fluctuations, time trends, yeah? Like whether it is realistic. And realistic, it depends on the public health. For example, like sometimes the diarrhea goes high. And diarrhea, if it goes high in rainy season, then we no. Malaria should be high in the rainy season. Diarrhea should be high in summers. Yeah. So this public health. Yeah. And people at the district level, please tell your district officers and everything. Look at this zeros and fives. If your data set, if most of the time is ending, a data value is ending with zeros, 10, 20, 100, or 15, 25, for most of the things, that means they are not really calculating it. They are just like, how much should I enter? 10, 20. That means they are not really entering the right value. Okay? If you look at your form, and in all the form is in the variable of zeros and fives, then the data what they're reporting is just not actual. They're just like averaging it and entering it up. Hey, just one of the things to look at the data quality. Yeah. You know, when we started, one of the participants said like feedback. Feedback is the best way to improve the quality. Because when a person is reporting up, they don't know someone is looking at it or not. So what we say, every report should have a feedback report. Yeah? So like if a person sends a report up, you should send report down, saying, okay, you are doing very good in the immunization, but bad in the family planning. So you give the feedback. Validation rules are two types, experts and absolute. For example, you have total delivery. Let's say this is for IT people. Okay? So only IT people will say. If total delivery is 100, live birth, can it be 100? Yes? Yes? No? Yes? If live delivery is 100, live birth, can it be 100? Possible? Can it be 110? Yes? Twin? Can it be 200? Yeah. Look, this is the medical doctor. He's saying it can be, but what about the wastage? Delivery wastage, because like if you have a delivery, not everyone like will deliver twins, and then there is also stillbirths, which is constant. So usually if it's 100 and 100 live birth, there is also like something flag up, because like there is a bit of wastage. And then like if it's like 105, it's also it's a bit of flag. But if it's 200, then it's obviously wrong. So we say total delivery should be greater than or equal to live birth. So delivery can be 100, live birth 90. Okay. If its live birth is 120, then it's some problem. Yeah, it's say should be, not must be. Okay. And like for example, like this is one from India. You have a number of ANC registration, and then you also collect. Okay, so many people came for first visit, and out of which who came before 12 weeks. So that like you can give the whole checkup. So most of the countries you calculate that, but like not in Laos and other place, because when we say ANC first visit is a coverage, but like when we say ANC first visit before 12 weeks, it's the quality of your service. So it's a different indicator. So then when you use that one, ANC first visit and then the coverage, if ANC first visit 100, can ANC first visit before 12 weeks be 200? Yes? First visit is 100, and first visit before 12 weeks. Okay, let me give a much more nicer example. Children weighed, like for all the nutrition program we have, children weighed. 10 children are weighed, and 20 children were low birth weight. Is that okay? No. So then like we clearly say, and these are what we say are like say automatic or absolute validation rules, which system can check and flag, see there is some problem. There are also some experts validation rules where you can put the percentage and public health. Like for example, 5% of your OPD cases should be lab tested. Yeah. So it's 5% of your OPD cases should be lab test. Yes, you should have so much lab test, 5% of your OPD cases. And you can also put those things. And this requires much more knowledge on the health to define your expert validation rules. So there are two validation rules. One is absolute, yeah, and other one is the expert one. Okay. Yeah, data used by the managers, it's all fine. So I'll just leave it on here. Yeah, we can skip this one. Skip this one too. Yeah. So in DHIs, you can define your validation rules. You can define like what is, how do you check your validation rules for your data set. Yeah. You can also use outlier analysis. For all the statisticians who are here, they know this one. A standard deviation. Yeah. How many people know about standard deviation? Yes? Yes? And people from Nepal, standard deviation, you know? Yes? Okay, let's take the mic and give and let them explain what is standard deviation. Very quick, eh? Just 5 minutes. The rod, the rod, the rod, the mic. Yes. Give it to the person over there because he's talking too much. So, good. So now you explain about standard deviation.
Standard deviation is the deviation from the mean value of the data or value taken.
Okay.
That is squared.
It's fine. Everyone understood? Really? So what is the mean then?
Average.
Yes. And like everyone knows it, but like it's always good to, because in DHIs, like we have, can we take standard deviation as 2? Which one should be the things? As 2 or as 1.5 or 5? The standard deviation. In a routine HMIs for monthly data. 2
Plus minus 2 standard deviation.
is fine?
Okay, yeah.
Yeah? So they help people agree on a monthly data plus minus 2. Yes? On a, okay? Really? In the back, research? Malaysia? You people doing lots of research and collecting granular data, and then, is it okay? Plus and minus 2? What do you use at your place? Plus and minus 2. Really? In granular data, plus and minus 2 is too big. Yeah, so it's usually you can like use 1.5. Yeah, or 3 if it is smaller data sets and things. Yeah, but like I'm not the expert on that one, but like I'll leave it to you people, okay, to decide. Always check. If you don't know, ask the statisticians for this particular period what should be the standard deviation, whether it is 2, 1.5, or 5, or if you use 5, then it's just like everything is fine. Okay? And then completeness and timeliness report. Yesterday we saw data entry screen, right? Did anyone look at the data entry screen, correct? In the data entry module, there was something called complete button. When you click on complete button, what DHIS does, and this is also the problem we have in Nepal because they have a different calendar. It's very hard to solve, and let's see. So when you click on complete, what DHIS does is just records the date and time when the user clicked on complete. And we can set, okay, this particular data set should you should report it 5th of every month. Yeah, and when they click on complete, DHIS will record it up. DHIS can give you how many people have submitted the report, what is the percentage of health facilities are submitted report, let's say mother and child care report, yeah, of the data set. How many health facility in my country are submitted on time mother and child health data set. Yeah, DHIS will automatically do that, but user have to click on complete. Why? It's just because when you click on complete, it will run the validation rules and everything, but also let's say, okay, then it's done. You can still edit it if you go back and like we can edit it up, but like we can, when you click on complete, it will calculate whether the people have submitted on time or not. First time when we started in Kenya, like it was just like very, very low people, it was just like say 10% were on time. But the problem is they didn't know to click on complete, they would do the data entry. And because DHIS, when you enter the data, it's automatically saved. Huh? You don't have to click on the save button. But like there is a complete to check the validation rules and check the data sets completeness. So when you click, please tell your user to click on complete button so that like you can automatically generate timeliness and the completeness report. Okay? Yeah, this we already know. Have you tried it, this one, in the data entry screen? How many people tried this one? You designed data entry screen, right? So did you try to enter any value? No? Aye. If you type, say, like there is yesterday Tuvi, when she was showing about option set, she made it as a number, and the option set was text. Yeah, yes, no, not applicable. So if your data element is number, when you enter text, it will show an error. This is some problem. This is normal data entry check. And then pop-up notification, let's say it's above the range, it will show up notify. This is above the range. Yeah, so you can get this one. These are data input validation rule. This is normal data entry check. Yeah, min and max, we've seen it. Next. Yeah. In DHIS, there is something called validation rules. More validation rules is better. Okay? So what we say, validation rules has a rule, and then a right side, left side, and operator. For example, total delivery, okay? Total delivery should be greater than or equal to live birth. Fine? Delivery 100, live birth 90. Fine? So what you have, delivery on your this side, right side, and left side, right side, left side, right, left. Is that right? Right, left. Okay. Really? You should know, like, what is your right side and your left side. So what operator? You always have to make sure, because like, just make sure what the data item you put it in. Okay? What do you put it on the right side? Greater than or equal to live birth. Okay? So then like you see these things. These are the different operators what you can try to use. For example, you say total delivery should be equal to live birth plus stillbirth. Equal to. Yeah? You can also say anyone, good validation rules. Health implementers. From your experience, what is a good validation rule? Any example of validation rule? You have a right side, you have a left side, and an operator. No, that's not a real validation rule. That is an analysis, because like then you compare across different months. You're not comparing in one particular form. Okay, so like when you're comparing BCG1 and BCG3, you compare it on a time scale. But like in data set in a form, like you always have a related field, right? So in a one form, one data entry form, just one form, or one data set, you always have a related field. Yeah, but that's I already told. Okay, M, Mike there. BCG. Vaccine expenditure. Yeah. Yeah. Simpler is live birth and the BCG given at birth.
Number of eligible couples must be more than contraceptive users.
No. Number of eligible couple is an annual data, right? And contraceptive user, it's you collect it. That's the thing. Users are very hard to collect in the routine HMIS. You don't know whether they are using or not. We can't check them. So, and then like you can do that in survey, and then it's a very different periodicity. Number of contraceptive user, you collect it every month, and eligible couple is once in 1 year or 5 years. So, because it has to be same periodicity. The easier way to look is take your data entry screen or data entry form and see if there is any connection. Yeah? Do you have an Excel sheet of yesterday? The data elements? Yeah, it's the Excel sheet of yesterday, assignments. Assignment 2, 3, 4, like which we had. Sorry? Yes. Yeah, but there is also like nutrition. But like, give more example here. Come on. No, that is fine. But like from your experience, Chung, Mike. Assignment 2 and 3. That like we have the creation of data elements.
No, this was from yesterday's
no.
assignment.
Like that's
like the leprosy, like the total amount of newly identified cases
okay.
should be more than the total identified new female cases.
Everyone agrees? Yes? Okay, one more time. Can you repeat? Because people were discussing.
The total amount of newly identified female cases in leprosy should
Can
be
you take
less
this
than the total amount of newly identified
Nah, one
leprosy
more.
cases.
Can you zoom it a bit? This is the one, right? Can everyone see this? This was the data entry screen, right? So, yes. One more time. Sorry.
See, number of new patients identified,
Yeah.
the first row,
Yeah.
must always be more than number of female patients among the new patients.
Okay. What about this one? If this one is 100, can this be 200? So every data set, what you see, there is always linkages. Huh? Okay, so you can always identify the linkage between data item. That's why, like we say, health are related. Huh? So you have the top and things, like you can like see which one is there. So anyone not from the assignment, but can tell about validation rules?
Number of people screened for TB.
Okay, one more time.
So for a TB program, number of people treated for TB should be less than number of patients confirmed for TB, and number of patients confirmed for TB should be less than number of people screened for TB.
Okay. It's 2 validation rules. I said 1 and you gave 2. Very good. One more, but this IT person, right? So the health, yeah, Sri Lanka, yeah, Budika.
Number of malaria new cases and number of new cases with positive Plasmodium falciparum.
Yes, yeah. All the way to in the back, WHO person. Now the group. Now just trying to make to active, including me. Okay, yeah, Solomon Islands. Yeah. You've been like using your form all the time, so you should be able to give lots.
Number of neonatal tetanus, number of babies protected from neonatal tetanus at birth should be equal or less than the number of live births.
Live births reported or registered, yeah. But like, what is neonatal tetanus? Yes. Thanks.
Yes. And number of acute flaccid paralysis cases is more than the confirmed polio cases.
Keep, AFP.
AFP, yes.
AFP should be more.
More than confirmed
Confirm
polio. Confirmed polio case.
Confirm polio cases. Okay. Any more? Yeah. So now what I do is to show you how we can do that one in DHIS. Okay. How we can test all these things in DHIS. You can open it. Tui, can you operate the things and show the? You can operate it, I can tell. Eh? So, validation rules, we put it in the services. We want more and more validation rules. It's fine if you have more and more validation rules, okay? It's not in the maintenance. You can define and you can generate it. So validation rules are in services. So services, and you go to a module called data quality. You can zoom out a bit. Matthew will do that. Here, services. You can also look at the place, okay? Services, data quality. And when we click on data quality, you have to log in. Yeah. So one more time, services, and click on data quality, and you get to here, okay? This is the place where you can define your validation rules, you can group the validation rules, and you can run the validation analysis. So what we do, we have the data, so we'll try to run the validation rules. Huh? So first we define a validation rule. We click on validation rules, and same, add new. And then we define, say, live birth, yeah, and BCG. Let's say live birth should be high and BCG should be low. Usually it's other way around, because not all the live births are reported. But this is very good to check. Live birth should be greater than BCG. We just like type, and it's just the name. And here you can give long description. Live birth should be greater than blah, blah, blah. Okay, but like it's fine. Don't have to worry. Clear? And then let's not do anything around here right now. Okay? We click on left side. No, this one. Left side, here. We click on left side, and we say live birth. Description in the top. We just also type, you can say live birth. And here, we can check, this is all the data elements what you're collecting, okay? So unlike you can filter out live birth, or just type births, it's fine. And then you have total live births and everything around here, okay? Let's just take a, look, you have all the different things, but like now I want to add this, lots of live births are there. Just go above 3. So we add this plus this plus this, and this plus this. This makes total live birth, right? So you can click on one live birth. Let's just say this one, community, plus. You have here plus, minus, and all different kind of operators, so you can make the validation rules better, eh? Yeah, plus. Next one, plus. Next one, plus. Okay, that's fine. That's fine. Okay, so we have all these things. We added. Live birth should be total live birth, and that's adding all the different things. And then the right side is BCG. And then you have all different kind of BCGs, but like we are BCG at birth. No. This is created by the group. I just come down. Let's just see. Let's go up. Let's just take BCG under 12 months. That one and this plus this one. Like BCG 15 to 12 to 59. The health person, can you explain? Is it relevant? No? Yes, no? BCG usually at birth, right? But like it's, you also have 12 months to 59 months. People around. Last group, very, very last group over there. Number 6. Group number 6. 6. BCG given 12 to 59 months. It's 1, 2, 3, 4, 5, 6. Yeah, the last one. 6. That's done. I can't see. Okay. But like I'm saying, okay, but you can hear us? Yes? I'm just saying BCG given 12 to 59 months. Is it okay or not okay? Or can you explain why? BCG at birth, I know, but like BCG 12 to 59 months. Nah. Anyone? Yeah. But like, okay, but like BCG, you have two things: under 12 months and 12 to 59. So what are you tracking on that? Okay. Okay. But like you just want to see like when it was given, before 12 months or before after 12 months. Okay. So we add add this one, BCG under 12 and BCG under 12 months, because we are taking live birth now. I hope it's both in the same data set. Yeah. Because I don't know about because it's all in serial database, it's the whole thing, so, but yeah. Save. And then we choose the operator. So what was the left side? Live birth. Right side? So which one should be higher? Live birth should be higher. BCG should be lower. Okay. Yeah, actually, like this is the one of the things that people have introduced recently. The developers. Yeah, just click on here. Like period type should not really matter. It's just like because it will calculate when it is, and sometimes you define the validation rules for that particular data set, and you have the same or different data type used in other places. So. But it's usually here. But there is, if you rule type, validation, but you also have surveillance. Click on here, Tui. Surveillance, and then like try to use that one. So they wanted to combine validation and surveillance at the both the time. This Martin will explain later. Yeah. Okay. So what we did, we defined the validation rule, left side and right side, and then we choose an operator. This is not really right, because we're taking live birth and we're saying BCG under 12 months. That's too much, okay? Now, you can compare it, yes, fine. But that's not a validation rule. That's an analysis. Okay, validation rules is always with the data set in your form when you enter it. So when you enter the data, like when you click, you get, you have to get the pop-up. Okay? This is one. Just save it. Okay, let's take Chung.
Can we create a validation rule? Sorry. Someone
Okay,
talking?
okay.
Okay. The total, let's say the total of in form 1 must be equal to another form.
Yeah, that's fine. It's okay.
Even in one form, we are entering a certain thing. So it might need to validate with something earlier.
Yeah, but like that's why like you have the other things on surveillance. But like it's last month and this month. Then you use min and max. But you can always use analysis to compare it. But validation rules is usually it's your form or your data set. You, no, it can be in the other form also.
Form also, it can
Yeah.
be older data also. But
No, not all data, but other form in the same data period. For example, you are collecting a form, say, HMIS form. You have a number of pregnant women registered in this month. And then you also have number of HIV case tested, pregnant women tested for HIV case in HIV form. And then you can compare these two, no problem. Okay, you can validate that one. It's just okay. If it's same periodicity. In the previous months and other things, you can still do it, but like it's we just say you can use it an analysis, not as a validation rules. So that's the okay. So we did this one. Okay, save. Okay, let's go to data entry. We select, let's select, okay, Chinnara province, the top one. So which one is it? It's that group? Okay, good. Leprosy data set, yeah. And then let's see the data set first. We have it here. Now what we do, this plus this, new patient, yeah, should be greater than this. Okay, let's create that one to be with the quality, validation rules, add new, new patient leprosy, yeah. Greater than 15 child. Let me look. This one. Under 15 child. Okay. And then we click on left side and how did you name? Group 2, right? Did you give any suffix to your data element? Prefix? Just type leprosy to me. Or no, new patient. new patient. So group 2, okay, let's come down. Really, you didn't create the leprosy data item with G2? Okay, let's just no. Okay, let's just open a new tab. Just no, new tab 3. Just click on group 8. But like group 8 has created a data entry screen. Okay, yeah, created data entry screen. Okay, let's take group 7 then. Just say G7. Group 8 is also created. Okay, so it's fine. Group 8, fine. Okay, let's just take leprosy case identified. Yeah. That plus plus. Is this okay? It's fine? A new patient identified. New leprosy patient identified. On the right side. Yeah, it's this one. No, it's here, there. New patient under 15, yeah, child. But like it's under 15, like you know, like you have in WHO you have this grading, right? So under 1 is infant, 1 to 5 is child, and then 5 to something is (15) is child. Okay, so you created, and then operator. And the period type, quarterly. Okay, so we already have lots of validation rules now. So now what we go to data entry. We click on group 8. And we do the data entry here. Here we type 1010. Okay, and you type 1010 here. Here. Yeah, but like here. And here we type 30303030. Is this okay? No, but it's no, right? But that's okay. Because we created the validation rules now. So we need to test it whether the DHIS is working or not. So it's okay now. But this is wrong, but it's wrong is okay.
Not everybody, they are not on the same instances.
Okay.
So they are a little confused.
No, but like we'll have a session.
Tell them that it's logical, but they don't see what to show because they at the back they are completely lost.
Okay. Like in the people at the back, don't worry. What we'll try to do after this, we'll come over there, like we can have a 5-10 minutes of practice, and then we have a group assignment, okay? And in the group assignment, we always help, yeah, how to create this one. So now, we created this. We go down, let's say complete. Let's just see. You see, that's why it's very important to say complete. You can also just run validation rules before the completion. But like when you say complete, it will always show, look, there's some problem here. This is all your expression, what you created. This is your left side. Left side was 40. And the right side is 120. So it's wrong, so it's giving an alert. But its data is still saved. DHIs don't stop in data entry. We save it, but like we'll alert all these things. Sometimes it may be true, sometimes it's wrong, because like we have to decide if it's wrong or right, not the DHIs. Okay? It's fine. This is for one form, one time. Now I want to run the whole validation rule for one particular province, for example. How do I do that? We go for services, data quality, validation rules we define, but like validation rule analysis, we run the for the whole country, okay, or province or anything. Here, I select start date. Just take a click on that, 13 January 1st to now. It's fine. It's fine. And we take one province. Let's just take this province or any province. Yeah. Yeah. Come down. No, don't worry about the groups. You can run all validation rules or a particular group. And then it will create this for the whole year. And it will show all the validation rules errors. So your district officers or a province officer, you can check for 1 month or all the month for all your health facilities when you create the validation rules. You can export all these things download as Excel, CSV or PDF. I always say Excel, it's because then you can make this highlight in red and send it to the facility and say comment. Okay? Understand? So look, this is ANC2 and ANC1. But like you can't really compare ANC2 and ANC1 in the same thing. Just come down. So this is validation rule problem. Let's go down. No. Wait. Just a bit up. There was one about maternal death. Maternal death occurred and 0. I don't know, maybe like they wanted to do these things, but like it's fun. Just let's see if they have any good validation rules. Okay. Is this fine? People asked at Penta 3 if exclusive breastfeeding under 1 year fixed, and Penta 3 under 1 year fixed. This is like, I don't know. Penta 3 is just a vaccine, right? Yeah, but not quite sure like what are the different things they have it. Just come down. Let's just come down more. Let's just keep all the different things. Yeah, but like if you define a good validation rules, you can get all these things. Okay? So now what you do, first try your validation rules, discuss among yourself, and based, you can open the assignment. You can open the assignment. You just specify medium, high value. When you define validation rules, there is something called medium, high things, then you can set it up. It's health people will say this validation rule is very, very high, this validation rule is low. And, okay? So now what you do, yes?
Can you temporarily disable a validation rule?
No.
No. Oh, so
You
it's
don't have
always
to
on.
run it.
Okay.
But like, why do you want to disable validation rule?
It's not yet final.
Sorry?
For example, you have to change it, and you don't know what the new rule has to be.
No, then like you delete it.
Okay.
Yeah. Don't put it in the system. But validation, more validation rules is better, and good validation rules. Okay. Now the assignments, no, we have a validation rule assignment, right? Yeah, custom forms and validation rules. Oh, okay. Maybe the second sheet? Ah, okay. Maybe like we missed that. So what you need to do is in your assignment 2 and 3, identify at least 3 validation rules. Yeah, there are more, but like at least 3. In your assignment 2 and assignment 3, yeah, in your assignment 2 and assignment 3 of yesterday, identify validation rule and then create it in the DHIS, okay? And we'll try to help you around in the back how to create it. It's fine? In your assignment 2 and assignment 3, please try to identify validation rules. Okay?